I once had a colleague tell me that we had a good setup, but that you didn't want to see what the guys at ROC Orthopedics had because that was orthopedics done right. I came to Oregon in 1999 after my service in the Air Force. So I practiced farther south in the valley. The first opportunity that I had, the group actually broke up, and I proceeded to a second opportunity. Fast forward a few years, and I actually got a call from a member of ROC Orthopedics telling me that they had an opening and would I be interested, which I took as quite a compliment to have a group that I had admired from afar for the longest time reach out to me. It was kind of a unique experience. After I came and surveyed the scene, ironically, I thought to my time during my training when they told us you have to be a lifelong learner. And I think the members of this group are, and that allows me to fit in well. I could tell that it would be a good fit. So I elected to join the group and take that opportunity that they presented. You know, when you look at the talent that's already here, you have to search to find where you'll fit, and I think I actually would fit well. The philosophy of the patient first, the philosophy of making sure you're staying current with techniques and technology. I would hope my addition to the group would be the perspective of coming from outside, a chance to see things from a point of view that they have not seen before. I think the experiences that I've had will allow better decision making on where to go in the future. Direct anterior hip replacement is something I started performing 11 years ago, and I think have mastered that technique and can offer that to patients. We're going to see more demands to do better care at less expense in a more efficient manner, and hopefully the experiences that I've had will allow us to continue to evolve as a group so that we can meet those challenges that we'll inevitably see in the future.